Sorry. Yeah, now it's coming. Thank you. I start now. Now it's coming beautifully. Yes, I can see. Great. I start with the first question. A young girl presents with painless genital ulcer and non-tender bilateral inguinal lymphadenopathy. What is the likely diagnosis? See, painless genital ulcer. That is a first clue. If we see chancroid, it is painful. Hemophilus ducrei, cry will be there. Genital herpes, painful. Primary syphilis, painless. Painless ulcer. It also painless ulcer. LGV also painless ulcer. Primary syphilis and LGV both are painless ulcer. And non-tender inguinal lymphadenopathy. Lymphogranuloma venerum, you have tender lymphadenopathy. Painful lymphadenopathy. Where painless lymphadenopathy, non-tender lymphadenopathy, you can go for primary syphilis. So syphilis totally painless, painless ulcer, non-tender lymphadenopathy. Lymphogranula venerum, painless ulcer but tender lymphadenopathy. Got it? Next is, which of the following bacteria is most often associated with osteomyelitis in sickle cell disease? Please remember, overall most common cause of osteomyelitis overall is Staphylococcus aureus. Overall common. In case of diabetes mellitus or in case of what is called rusty nail, you can think of Pseudomonas aeruginosa. And sickle cell patient, you can think of Salmonella species. Sickle cell patient, it is Salmonella species. You can go to Salmonella species. Sickle cell, Salmonella. Okay. Next is, which of the following is an AIDS defining illness caused by protozoan? What is called AIDS defining illness? What is called AIDS defining illness? Please remember, if this infection is present, you can suspect HIV, and you can do HIV testing. If you do HIV test, 90% it will be positive. That is called AIDS defining illness. Classical is cryptococcal meningitis, esophageal candidiasis, Kaposi sarcoma, many are there. Extrapulmonary tuberculosis, many are there. If you see the list, they ask particularly protozoan. Pneumocystis is fungus now. Giardia is not a AIDS defining illness, anybody can get. These two are usually cryptosporidiosis. Cryptosporidiosis, toxoplasmosis, both are AIDS defining illness. But among these two, most consistent AIDS defining illness is toxoplasmosis, which is caused by Toxoplasma gondii. Cryptosporidium also a AIDS defining illness. But among the two, if you go for best choice, we can go for toxoplasmosis. If the toxoplasmosis is not there, we can go for cryptosporidiosis. Next is, which type of hepatitis virus most commonly associated with chronic liver disease and cirrhosis? Please remember CCC, cirrhosis, chronicity, and hepatocellular carcinoma. It is usually caused by hepatitis B and hepatitis C. These two people usually causes cirrhosis, chronicity and hepatocellular carcinoma. So hepatitis A, fecal-oral route, no chronicity. Hepatitis D, fecal-oral, no chronicity. Chronicity and this thing, chronic liver disease, cirrhosis. Here hepatitis B, another option is hepatitis C. One is hepatitis B, another one is hepatitis C. Next is a food handler presents with fever. Food handler, that is a point. That means anything foodborne disease. Fever, relative bradycardia and hepatosplenomegaly. What is the diagnosis? Typical. Relative bradycardia. Rose spot, coated tongue, rose spot, coated tongue, hepatosplenomegaly, hepatosplenomegaly, stepladder fever, intestinal ulcers, coma vigil, all are features of typhoid. Okay, suppose if you don't know this, you can rule out. Shigellosis amoebiasis produces bloody dysentery, bloody diarrhea, dysentery, mucus, stool with mucus. Hepatitis A causes diarrhea outbreaks. Yellow discoloration of skin, sclera, secretions. Yes, you are right, Dr. Lavanya Raja. Right. This is typhoid fever. Next is, which of the following viruses associated with congenital anomalies when infection occurs first trimester of pregnancy? So I will remove toxoplasma. Toxoplasma is a protozoa. Here virus. Influenza usually causes congenital infection, no congenital infections. Mainly rubella. Measles also not up to the mark. Rubella causes a condition called congenital rubella syndrome. Congenital rubella syndrome. Congenital rubella syndrome. It is a triad of CCC, cardiac defect, patent ductus arteriosus, cochlear defect, sensory neuronal hearing loss, bilateral, and congenital cataract. Cataract, congenital cataract, measles, so rubella. First trimester, very common. Rubella damage will be more common in the first trimester. That's another clue. Virus is the first clue. And another clue is first trimester. Excellent. Dr. My Purple Hues. Good name. Next is, which organism causes bloody diarrhea with flask-shaped ulcer seen on colonic biopsy? If you take the biopsy, it is the surface, it spreads submucosal spread. Flask-shaped ulcer. Flask-shaped ulcer is the classical feature for flask-shaped ulcer. Classical feature for which one? For example, Giardia produces steatorrhea. Giardia produces steatorrhea, fatty stool. Shigella campylobacter produces bloody diarrhea. And intestinal ulcer, flask shape ulcer produced by Entamoeba histolytica. The answer is Entamoeba histolytica, flask shape ulcer. Onchocerciasis pus in liver abscess. It also causes onchocerciasis, liver abscess. Onchocerciasis, liver abscess. Onchocerciasis, liver abscess. Got it? Next is, right, a farmer, that's all, is a zoonotic disease. Wherever the doubt comes, question comes, farmer, immediately you should think it is zoonotic disease. Okay. Yetshar on the leg, regional lymphadenopathy and flu-like illness. What are the most probable diagnosis? Please remember, Yetshar seen in scrub typhus, Yetshar seen in tularemia, Yetshar seen in cutaneous anthrax, except leptospirosis. But is a farmer, and with regional lymphadenopathy, you can think of cutaneous anthrax. It is otherwise called Hyde-Porter disease. And malignant pustule. Do not forget, scrub typhus means there is history of mite bite. Tularemia, their close contact with rabbit. Farmer, usually you can think of without any clue. The most common is anthrax. It is cutaneous anthrax. It is cutaneous anthrax. Next is, which are the following most common cause of neonatal meningitis? Neonatal meningitis caused by Belk, not Neisseria. Neisseria causes adults. Neonatal, the mnemonic is Belk. Group B streptococcus most common, E. coli. Next is Listeria. And Klebsiella pneumoniae. And Klebsiella pneumoniae. Clinical feature in scrub typhus, it's questioned by Dr. My Purple Hughes. It's Yetshar, fever, malaise, lymphadenopathy is also present, and Yetshar, mainly Yetshar is the classical picture in scrub typhus, which is caused by Orientia susugamushi. Here most close is scrub typhus, but scrub typhus they can give mite bite. If there is no cutaneous anthrax, your choice will be scrub typhus. You can go to scrub typhus. Okay, right. Here these people causes neonatal meningitis. Among these, most common is group B streptococcus. See, this the most common cause of neonatal meningitis is group B streptococcus, otherwise called Streptococcus agalactiae. Group B streptococcus, the common name is Streptococcus agalactiae. It is CAMP test positive. It is a test called CAMP test positive. This is all you studied in bacteriology. Now you need to apply. All the bacteria we have studied in bacteriology. Now we are going to apply each and everything. Which zoonotic infection commonly transmitted through cat scratches and causes regional lymphadenopathy? This disease is called cat scratch disease. This disease we call it as cat scratch disease. We call it as cat scratch disease, which is caused by Bottonella Hensley. It also causes bacillary angiomatosis. Bacillary angiomatosis. Leptospira by rat urine. Penetration of skin. Toxoplasmosis cat feces containing oocysts. Tularemia by rabbit. So cat scratch disease caused by Bottonella Hensley, and it also causes bacillary angiomatosis. Treatment usually doxy, streptomycin, many are there. Next is a patient presents with high fever, retroorbital pain, maculopapular rash, and positive for tourniquet test. Positive for tourniquet test. Which one? Make it easy. Tourniquet test positive. Thrombocytopenia. Rash, maculopapular rash, retroorbital severe pain. Close your eyes. You can vote for dengue fever. Dengue fever. Because typhus, you have rash in the palms and soles. Not retroorbital pain, no positive tourniquet test. Measles, you have maculopapular rash. But rash commonly seen in the face, there is no pain. There is no positive tourniquet test. Chikungunya mainly affects joint pain. So dengue fever is positive for tourniquet test. There are 5 types of dengue there. Dengue 1, 2, 3, 4, 5. What is the vector for dengue? Aedes aegypti. Am I right? Aedes mosquito. Aedes aegypti. Got it? Aedes aegypti. Next is, which of the following disease transmitted by CC fly? You must know the vectors, my dear. CC fly, where it comes? Okay, we'll read one by one. Yellow fever by Aedes mosquito. Aedes aegypti mosquito. Chagas disease by redweed bug. Otherwise called triatom bug. Kala azar. Vector is leishmania. Kala azar. Vector is leishmania. African sleeping sickness. Caused by Trypanosoma brucei. We have West African, East African. Brucei. Vector is CZ fly or tsetse fly. Mode of transmission, bite. It causes winter bottom sign. Winter bottom sign. What is winter bottom sign? Enlargement of post-auricular lymph node. Posterior auricular lymphadenopathy. Posterior auricular lymphadenopathy. Posterior auricular lymphadenopathy. Winterbottom sign. Next is, what is the most common viral gastroenteritis under children 5 years of age? Please remember, children less than 5 years, most common is rotavirus. Adenovirus causes infantile diarrhea. Serotype 40-41 causes infantile diarrhea. Norwalk virus, most common in adults. Most common in adults is Norwalk virus or norovirus, and children is rotavirus. Astrovirus also causes gastroenteritis, but most common in children is rotavirus. Direct question. Next is, a 6-year-old boy develops fever, vesicular lesions on hands, feet and mouth. Vesicular lesions on the hand, feet, mouth. What is the most likely diagnosis? We call it as hand, foot, mouth disease. We call it as hand, foot, mouth disease, caused by Coxsackie virus. Coxsackie virus. Coxsackie virus. Measles, maculopapular rash in the face and the body. Herpetic stomatitis around the mouth. Chickenpox in the trunk. Goes to limbs. Herpetic stomatitis in the face. Okay, measles, head, face, moves to trunk. So it's a typical hand, foot, mouth disease. What is the common name? Recently people had local name tomato flu. People call it as tomato flu. Which of the following infection is common cause of pneumonia in patients with cystic fibrosis? Pneumonia in patients with cystic fibrosis. Always remember, cystic fibrosis, you need to know the common culprit is Pseudomonas aeruginosa. Legionella causes atypical pneumonia. Klebsiella pneumoniae causes Friedlander's pneumonia. Streptococcus pneumoniae, it causes lobar pneumonia. Pseudomonas aeruginosa, commonly seen with cystic fibrosis. Selective medium, cetrimide agar. Important virulent factor, exotoxin A. Important virulent factors are pyocyanin, pyorubin, pyomelanin, and pyoveridin. Pyocyanin, pyorubin, pyomelanin and pyoveridin. A child presents with fever and slapped cheek rash, lacy reticular rash on the trunk. What is the causative agent? Always remember, slapped cheek rash, think of parvovirus B19. All people produces rash, but slapped cheek rash is parvovirus B19. It is appearance, slapped cheek appearance. Exact term is blueberry muffin rash. Caused by both, rubella also causes blueberry muffin rash, but slapped cheek appearance with blueberry muffin rash, think of parvovirus B19. In sickle cell patients, what does it causes? Sickle cell patients, pure red cell aplasia. Sickle cell, pure red cell aplasia. Patient presents with high grade fever, conjunctival suffusion and muscle tenderness after wading through flood water. Wherever conjunctival suffusion, high grade fever, always remember leptospirosis. Leptospirosis. Okay, leptospirosis. Because dengue, you have subconjunctival hemorrhage, bleeding, fever. Malaria, black water fever. Typhoid, stepladder fever. Dengue, breakbone fever. Black water fever, stepladder fever, breakbone fever, like that. Leptospirosis is always called rat fever or swamp fever. And leptospirosis, it's a biphasic disease spread via rat excreta. Treatment, doxy. Treatment, doxy. Which hepatitis virus known to cause fulminant hepatic failure, fulminant hepatitis in pregnancy? Direct question. Fulminant hepatitis in pregnancy, high mortality, is hepatitis E virus. High mortality. High mortality, hepatitis E virus. Got it? Next is, which bacterial pathogen is known for causing hemolytic uremic syndrome? Hemolytic uremic syndrome. Hemolytic uremic syndrome, HUS, hemolytic uremic syndrome. Hemolytic uremic syndrome usually caused by E. coli O157H7. What is hemolytic uremic syndrome? It's a triad of ATM, acute renal failure, thrombocytopenia, and microangiopathic hemolytic anemia. Microangiopathic hemolytic anemia. Hemolytic uremic syndrome, acute renal failure, thrombocytopenia, microangiopathic hemolytic anemia. Got it? Right. Next is Vibrio cholera causes rice water stool. Salmonella typhi causes enteric fever, typhoid fever. Shigella soni causes bacillary dysentery. A patient with history of unpasteurized milk, that's a clue, with no pasteurization. Conception develops undulating fever. What is undulating fever? Daytime the temperature will be high, night time the temperature normal. That is called undulating fever. Is caused by brucellosis. Q fever caused by Coxella burnetii. That also due to unpasteurized milk. Typhoid also due to unpasteurized milk. These are all causes unpasteurized milk. All three people unpasteurized milk. But undulating fever, Malta fever, you can see brucellosis. Suppose if they mention stepladder fever, you can go for typhoid. Got it? Next is which parasite associated with perianal itching, especially at night in children? Perianal itching, especially night. Anal itching, keep the finger in the mouth, leads to auto-infection, is Enterobius vermicularis. We call it as pinworm. It causes auto-infection as well as appendicitis. Appendicitis. Treatment albendazole. Ascaris causes intestinal obstruction, low flux pneumonia. Intestinal obstruction, low flux pneumonia. Strongyloides stercoralis, it is ovoviviparous. That means they lay the egg immediately become larva. Trichuris trichura, what is it causes, my dears? In children, very important point, rectal prolapse, we call it as coconut cake rectum. Rectal prolapse, coconut cake rectum. Okay. Which one of the following is most common cause of infective endocarditis among IV drug users? IV drug users, most common cause of infective endocarditis is Staphylococcus aureus is the most common among IV drug users. IV drug users always think three people. One is Staph aureus, Pseudomonas candida. These three people commonly seen with intravenous drug users. Streptococcus viridans you can see in prosthetic valve infective endocarditis. Prosthetic valve infective endocarditis. Okay, Staph aureus, most common cause of overall infective endocarditis, commonly seen intravenous drug users, and it affects both valves, bicuspid as well as tricuspid. It affects both the valves, bicuspid as well as tricuspid. A woman presents with dysuria, increased frequency and suprapubic tenderness. Urine culture shows more than 1 lakh colony forming unit, lactose fermenting, indole positive, gram negative bacilli. Please remember, more than 10,000, 10 to the power 5 colonies, lactose fermenter, Pseudomonas is non-lactose fermenter, Proteus non-lactose fermenter, indole positive is E. coli because Klebsiella is indole negative. Klebsiella indole negative. Indole negative. Got it? And what are the agents causing UTI? You follow my mnemonic, remember? Keeps is my mnemonic. Klebsiella pneumoniae, E. coli, Enterobacter, Enterococci, Proteus, Pseudomonas, Staph epidermidis, Staph saprophyticus, Serratia, like many people are there. All these people are bacteria causing UTI. These are all list of bacteria causing UTI. Keeps. So Klebsiella pneumonia is indole negative, but it is lactose fermenter. These people non-lactose fermenters. These two people non-lactose fermenters. Remove. And E. coli is lactose fermenter as well as indole positive, and it is the most common cause of UTI overall. Which of the following statement about Clostridium tetani is true? True statement. It is gram positive bacilli. I remove this. Produces heat stable toxin. No, it is heat labile toxin. Blocks inhibitory neurotransmitter release. Yes, it blocks GABA and glycine, which leads to spastic paralysis. So correct statement is it blocks inhibitory neurotransmitter release GABA and glycine. Just opposite function is botulinum toxin. In case of botulinum toxin, it blocks the release of acetylcholine, which inhibit the release of acetylcholine, which leads to flaccid paralysis. Like floppy baby syndrome, like that. Okay. Which skin manifestation most characteristic for secondary syphilis? Please remember, syphilis primary painless ulcer, secondary rash. We call it as condyloma lata, maculopapular rash involving palms and soles. We call it as condyloma lata. Genital warts caused by human papilloma virus. Painful inguinal lymphadenopathy, LGV, lymphogranuloma venereum. Painless genital ulcer, primary syphilis. They want secondary syphilis, so you can go. So tertiary syphilis is nothing but cardiovascular syphilis, aortic aneurysm, neurosyphilis, general paralysis of insane, tabes dorsalis, many are there. Maculopapular rash involving palms and soles is condyloma lata. Condyloma acuminata is genital warts. With this, we completed our important questions in infectious diseases. What you studied in microbiology, just you can microbes, bacteria, virus, fungus, separate. Now you are going to read everything in a horizontal manner. Vertical is microbiology, horizontal systemic or infectious diseases. Any doubt? You post in the chat box. I'm closing the session. I'm waiting for